Managed healthcare, the secret to a successful practice. Hi, I'm Dr. James Machino. You know, all successful chiropractors acknowledge that building a maintenance practice is critical to having a large practice that is highly profitable. Now, I'll just tell you quickly how I did it. You know, once I was treating the patient with my chiropractic skills and they started to feel better and they had confidence in me, I explained that, you know, their normal day-to-day lifestyle practices, occupational stresses, emotional stresses, over time we're probably going to tighten their muscles up again and lock their joints and create some kind of nerve pressure that would likely, cause the initial condition to maybe come back or to flare up again. And because that is sort of their weak link, that's where they're going to feel the problem. Or their headaches might start coming back. Or their arthritic problems might become more inflamed again, or it would accelerate the degenerative process in their arthritis. So I would say to them, you know, all you really need to do is have a periodic tune-up with me. And it's no different than if you go to see your dentist and a dental hygienist cleans your teeth, and you know, if you never eat, as you were never going to eat again, you probably wouldn't build up very much plaque. But because the person's going to go back and introduce the same stresses that built up the plaque in the first place, the dentist probably wants you to come back in 3 months or 4 months or 6 months, whatever they think is right for you, to have the plaque taken off your teeth again. So it's like a periodic checkup. It's no different with chiropractic patients. I remember having a patient who loved to play golf, and he was overweight, didn't really want to exercise, and he found that if he just came to see me every Monday morning and I treated his low back, that he could play golf all through the week, and he was happy to come to my office once a week for a periodic tune-up. Once a week for him was the maintenance schedule. He wanted it and it worked for him. Other people might be every 2 weeks, somebody else once a month, somebody else maybe every 3 months, somebody else every 6 months. It really depends on the case. The idea is to be really honest with the patient, not to over-recommend care, but give them the right amount of care to keep them functional. So that's the neuromusculoskeletal aspect of a maintenance practice. But what about the more comprehensive health management issues? There's a great need here, and this really is the hidden gold mine that most chiropractors are missing out on in terms of profitability and a large number of new patient referrals. Let me explain what I'm talking about. The major health problems that are on the minds of people in society today are these kinds of problems. High cholesterol leading to a heart attack, high blood pressure leading to a stroke, people who are diabetic or they're pre-diabetic. 80% of people have diabetic and pre-diabetic problems. It's lifestyle management. This is how they got into trouble. Osteoporosis. People get older. They've seen people with osteoporotic fractures and the devastating consequences. Maybe they've been diagnosed with osteoporosis or they have osteopenia. What about memory loss as people get older and risk of Alzheimer's disease? This is what they're concerned about. Men whose prostates are enlarging. Men and women who are losing their sexual libido, and men who are losing their sexual performance capabilities as they get older. The management of menopausal symptoms without hormones. That's what women want to know about. And younger women with fibrocystic breast disease, uterine fibroids, endometriosis, PMS problems, and patients with different types of autoimmune diseases and many other conditions. These are the primary health problems that we face as society today. And the truth is that modern medicine treats most of these things by just giving individuals drugs. Yet, the peer-reviewed scientific evidence shows that for most of these health conditions, the inclusion of dietary modifications, lifestyle adjustments, certain specific targeted supplements, or the role of certain types of exercise help to improve the overall management of these conditions. Yet most medical doctors don't provide it. So individual members of society have become aware that these things are important, and they're seeking these things out on their own. In fact, during the 1990s alone, there was a 50% increase in the use of alternative medicine across the U.S. population. Here's the problem before you go cheering for yourself. And that is that there was zero increase in utilization of chiropractic care. So alternative medicine is growing. Chiropractic care is staying flat if you look at percentage of use across the population. People are not coming to us for these primary health issues. They see us as back crackers and bone crunchers. Now in the next video, I'm going to teach you how the exact steps necessary to step into the role where patients will see you as the trusted authority to address these major health issues. But right now, what I want to explain is that all the data shows that chiropractors are missing the boat and the big opportunity, not only to build the practice, but to help many more people. How do I know this for sure? The Eisenberg study in the Journal of the American Medical Association during the 1990s showed that the therapies, the alternative therapies that are gaining the most ground most rapidly include herbal medicine, massage therapy, megavitamin therapy, self-help groups, folk remedies, energy healing, homeopathy, and of course, you know, naturopathy is flourishing. But chiropractic has had zero increase in its utilization during the biggest boom for alternative and complementary medicine. So the reason is, so why is this happening? Because we don't address, people don't see us as experts who address the bigger need recognition that people have. The profession doesn't do a good job of it, and individual chiropractors, for the most part, are not doing a good job of it. So the general public is pretty much guessing where to go and find this information. Now I'll tell you the sad reality. The sad reality, and it's because I've been teaching nutrition and natural medicine to chiropractors since 1984, the sad reality is that chiropractors are best suited to actually step into this role. Why? Because we have a science-based education and we have a standardized approach to the patient assessment. And I will tell you, even though there's some very great naturopaths and some great holistic nutritionists, from one clinic to the next, the actual assessment, the needs analysis, the actual examination differs from one clinic to the next. Whereas in a chiropractic setting, there's a standardized approach to the patient assessment. Chiropractors think scientifically. Also, we see patients who are still functional. We don't see, people are still ambulatory. They can still move around. We can catch things early enough to actually turn it around. They're not going to an emergency room. They're at end-stage disease. They only have 3 days to live. We get people during their functional life when it's not too late to actually put the lifestyle changes in place to change the direction that their health is headed in. And I will tell you that with the right tools, you can identify the major health risks that people have and that they're worried about, and provide evidence-based diet and lifestyle solutions that are practical for them to implement. Now, I've created all the tools that you need to make this happen, which I explain on the next video, which is called How to Build a Managed Health Care Practice. The thing is, we can't leave this to medical doctors to do because they miss things all the time. And they often don't identify early risk factors, and they certainly don't provide patients, for the most part, with a comprehensive individualized lifestyle program that includes dietary change, the right exercise protocol, and the right supplements that have been shown in human clinical studies to be effective. So how does this really help your practice? You may still be skeptical that this may not be the route you want to take, but I will tell you this, that baby boomers who are alive today and young seniors have lived long enough to watch their parents get sick, and for the most part, many of them have watched their patients even die of all these degenerative diseases, and they've realized that modern medicine does not have any real answers that are meaningful at the end of the day. And so they're saying, you know, I want to do whatever, I know I can't rely on medicine to do this. I'm looking for someone who can guide me so I can prevent these problems before they escalate into a more serious stage where it becomes life-threatening. How do I prevent, my cholesterol's a bit high, I see these things I've lost some bone density. How do I put the lifestyle measures in place, because I know drugs alone are not going to do it. Also, when they're put on certain drugs, they go on the internet and they look them up and they find out this drug actually causes liver damage or kidney damage or erectile dysfunction or internal bleeding or creates ulcers. They're saying, if I could find something that was natural, that was safe, that's been shown to be effective in humans, that was much less toxic, I would use some kind of alternative medicine solution to help me, or even in conjunction with the drug so I could lower the dose of the drug. The problem is they don't know where to get the advice from. So they go seeking alternative medicine people, and they don't come looking, they don't ask us for this help. The other thing is that they want to know how to slow and reverse many aspects of the aging process without using hormones. They know that hormone replacement therapy increases risk of breast cancer, uterine cancer, prostate cancer, growth hormone increasing diabetes and other problems. They want to know, how can I do this naturally? Because they want to remain functional, both their body and their mind, for as long as possible. So simply stated, people today are, more than at any time in a history of man, are looking for someone they trust who can step into the role to give them specific science-based solutions with respect to diet, supplementation, exercise, and other lifestyle modifications. The key is, how do you gain their trust? Well, I'm going to explain that on the next video. But once you do get their trust, it allows you to assume the role as their comprehensive health management advisor. Your goal is simply this: to be seen by your patients and your community as the trusted and credible professional in this regard. Now, it requires implementing in your own practice. It can't just be you're giving lip service to it. In your own practice, you have to implement a managed healthcare model. I'll help you do it. But in the 17 years where I practiced chiropractic full-time, I attracted over 10,000 new patients using the managed healthcare model that I'm going to explain to you in the next video. Right? And so in that video, I'm going to explain to you the exact procedures, the exact tools that you use, how to do it flawlessly, and how to do it so it's time efficient. You don't have a lot of time to spend here. It has to be cost effective, has to be highly profitable, and it has to bring you a ton of new patients to keep you engaged. Now, why am I so passionate about it? Because people need your help, that's why. Now, one small secret before I sign off here, and that is the earlier in the patient relationship that you introduce these key managed healthcare tools, the sooner the patient is going to change their image of you from being a back cracker, bone cruncher, to a trusted health management advisor. And once that transition occurs in their brain, they're never going to want to let go of you. It paves the way to them sending you a lot more new patient referrals much earlier in the treatment cycle, because they begin telling all kinds of people about you because you've exceeded their expectations, and they recognize the wider group of health conditions that you can actually be involved in to help people. So a lot of people start to come to mind who they should be sending to you. It's really that simple. So I want to thank you for watching this first video so I explain the importance of this. Be sure that you watch the next video where I explain exactly how to build a managed healthcare practice. I think you'll find it highly informative. Thanks so much for watching.